Okay, so Judith, thank you for letting me know you couldn't hear me. Did that fix the problem? Judith, can you hear me now? Those of you who are with me on the webinar, can you hear me? I just need to know that I've actually done my audio right. Yes, okay, great. Thank you so much. Excellent, thank you. Yeah, it helps to take the microphone off mute, doesn't it? Yeah, one of those little details of the tech side of things. So as we look at this, I'm going to take a moment to introduce myself because I love what I do and I want you to know who I am, right? My name is Judith Cobb. I'm a master herbalist, natural nutrition clinical practitioner, and a certified iridology instructor, certified with the International Iridology Practitioners Association. I have been in holistic health for 4 decades now. I started out just barely 20 years old, jumping ship, leaving university. I was going to be a school teacher, but I was really interested in holistic health. And along came this really handsome young man who I kind of fell for. He was using herbs. I decided to use them because he was using them. His mother was a lay trained herbalist, so I started working with her. And before I knew it, I was a holistic practitioner. Now, back then, there wasn't a lot of training available. You just kind of did the lay training or the apprenticeship type of training. Now, of course, there's a lot more available, and I've certainly upgraded my skills since 4 decades ago. I absolutely adore teaching. I love working with my clients one-on-one as well. Those are the two joys in the business side of my life. Today, we are going to spend some time, about 40 minutes or so, talking about how to do a clinical iris analysis in the constitutional style in 20 minutes or less. Now, this is super, super important. And the reason I say this is because so often when we are looking at iris analyses that are being done on social media, especially, they are not done in the constitutional style. And because they are not done in the constitutional style, they take forever. They actually are, in my opinion, not effective. And I'll tell you why I say that. I started out 4 decades ago learning non-constitutional iridology. Now, some of you might be familiar with Bernard Jensen's work and people like that. That's where we all started because that's what was commonly available 4 decades ago. I did that style of iridology for nearly 10 years before I went, this is so not working. Iridology was not making my business work better. It was not making my client work better. It was just not. It was not doing what I needed it to do. It wasn't doing what my clients needed it to do. And so that was when I was blessed with the opportunity to learn constitutional iridology. And I don't believe in accidents. I believe that when the student is ready, the teacher appears. And that's exactly what happened for me. Is when I was frustrated with doing Jensenian iridology, a constitutional teacher appeared. And it was a blessing, truly a blessing. And that is where I began my studies in CI 30 years ago, about 30 years ago. And I have never looked back. I've only built on that foundation since then because it was such a solid foundation. So as we are looking at this, we're going to look at 2 sets of eyes and we're going to do 2 analyses, and it's going to take us less than 40 minutes to do both of those. I'm going to show you exactly how this is done and walk you through why it's done this way. Now, I would like to see a show of hands. How many of you, whether you're with me on Facebook, Instagram, or on the webinar, how many of you have seen these iris analyses that are being done on Facebook where people are naming diseases and saying, oh, you better look out for this and you better take care of that. And they're giving long lists of problems and long lists of possible solutions. Let me know a show of hands, or I've seen that. Give me a message somewhere letting me know that you've seen that kind of thing. Have you seen that? Yeah? Okay, I see a lot of it. Maybe that's because I'm sensitive to it and it drives me crazy. Judith says she's seen that. Thank you, Judith. I appreciate that. And Monica says she's seen it frequently. Yes, thank you, Monica. I appreciate that. Christy's giving me the hand wave. She's seen it too. Excellent. Thank you so much. This is what we are going to start putting an end to today. Okay. I also would like to know if you actually have any constitutional iridology training under your belt already. If you do, would you just put a CI in the comments somewhere, CI, to let me know you've got constitutional iridology under your belt, because this will not make sense. Well, I shouldn't say it won't make sense. It will make more sense if you've got CI. Judith says, no, she doesn't. Oh, Judith, I'm so glad you're here, because hopefully that means that I get to teach you the right way to do things, okay? This is really important. Here we have our first set, our first eyeball. And again, for those of you who were with me on Instagram, I'm going to move my camera closer so you can actually see the image clearly. And I apologize, it'll be a little wobbly because now I'm going to be holding it in my hand instead of putting it on a tripod. Alrighty, so this is the left eye of a female client in her early 30s. She had been trying to conceive for about a year. And they'd really been focusing on conceiving for about 5 months prior to her coming to see me. All of her medical labs were textbook perfect. And so that was odd. There was actually some symptoms that belied her medical labs. And so as we looked at things, we started working on things. But her husband specifically, his sperm test showed that some deficiencies. But he really was, I'm not going to say in denial, but he decided that if it was going to happen, it would happen, and he wasn't going to do anything. He just wanted it to be her problem. And he kept saying, it'll happen when it happens. And really, he was not engaged in this process at all. So all we could do was focus on the female client whose eye we're looking at right here. And as we did that, she was using ovulation predictor kits, which are shortened as OPKs. And it showed that her luteinizing hormone surge was happening about day 12 to 13, which is fine because that would be an appropriate time for a roughly 28-day cycle to have the LH surge, which means ovulation is going to be happening imminently, right? The thing that didn't sit straight with me was her labs, including her ultrasound of her uterine lining, said everything was good, except for her uterine lining, which said it was, actually, no, her test said it was good. It was her menstrual flow that said it wasn't. She described her menstrual flow as being very light, not really even a flow at all. She didn't even need a panty liner. Her menstrual flow was a smear on the toilet paper. Now, for those of you who know anything about fertility, you know that that's not enough of an endometrial lining for a fertilized egg to implant anywhere. She also had almost no ovulation mucus, which also says that her hormones are not well balanced. So in spite of her lab test, which said, yeah, she's ovulating, which she probably was, and her OPKs, which said she was ovulating, there was enough other things going on that if she conceived, it would not be possible for her to carry easily. So this is her left eye. And when we look at this, knowing that bit about her history, and with constitutional iridology, we always want to know the history. The history helps us understand. It gives us context for what we are looking at. It helps us understand the questions that the eye is going to teach us to ask. That's a really important distinction here, is that with CI, we are looking for the questions that the eye is teaching us to help us gather more information about our client's situation. So this is being a lymphatic eye suggests that she has a predisposition towards being too acidic in her tissues and in her blood, that she may be prone to excess mucus, to potentially some lymphatic challenges, to some allergy challenges. And so this is kind of the direction that I was thinking as we were going. So the first thing I wanted to know as I look at these eyes is, what is she eating? What is her diet? Now, her diet was amazing. It's like, can I move in with you? Really, seriously, her diet's primarily organic from scratch, really healthy, better than how I eat, which is pretty darn good. So she was doing really, really well. So what does that tell us? It tells us that the likelihood of her being over acid is reduced because her diet was so good. If she was eating a junk food diet, lots of red meat, lots of white flour, lots of white sugar, I would then we'd have had a conversation about reducing her acid levels by correcting her diet. But her diet was really good. Lots of vegetables, leaning towards the vegan side of things, lots of fruits and local fruits and locally grown vegetables and nuts and seeds and lots of vegan types of proteins. So she was doing had a really good foundation for us to work from. And from there, the next question needed to be about the protein balance. And I felt strongly as she described her diet that her protein was not quite high enough. And so we needed to then talk about getting more protein and getting more fats, because her diet being high in vegetables and high in lentils and legumes, it had some seeds, didn't have a lot of fat in it. Now, this is why it is so important for us to understand anatomy and physiology as we are doing iridology, is because, if you don't know how critical fats and proteins are to the hormone balance, then how are you going to know to recommend that she needs to enhance her protein and her fat intake? Right. So really important for you to know that. If you need a good anatomy class, let me know and I can connect you with one that's taught by a well-recognized institution here in Canada. I don't even get a commission for recommending them. I just believe in their anatomy program that strongly. As I look at these eyes, I also see she has this oat straw yellow in here. And it's a little hint of oat straw yellow down here. Now, so what does this suggest? This suggests that I do need to ask her about her acid balance. Is she aware of any acid symptoms? Does she have allergies? Does she have sinus congestion? Does she have any skin issues? Does she have any allergies? Now, she also has a teeny tiny little bit of a pigment here that might be really hard for you to see right here, that suggests to me that that she may not methylate her B vitamins very well. And if you know about the MTHFR defect, you know that for women, well, for men and women that have the MTHFR defect and don't methylate their B vitamins well, it really increases their chance of having fertility challenges, right? So I saw that right there. And so that meant I needed to ask her, what was she doing for B vitamins? Now, she was doing just an over-the-counter from the drugstore cheapo prenatal, and she wasn't taking any extra folate. And so we needed to get her going with a good prenatal vitamin that had methylated Bs, and we added a little extra methylated B to her program as well. Then we noticed that she's got a little bit of thickening out here. I don't know if you can, yes, you can. I think you can see this clouding where the clouding is a bit thicker towards the outer edge. Those are called tophi. And what they suggest is that she may be at risk of having her lymphatic system congest on her, get thick and sludgy. Now, the lymphatic system is what brings the garbage out of the cells and helps your body to keep its tissues clean. It also plays key roles in the immune system and the immune response. So I needed to ask her, because I already knew her diet was good, what does she do for physical activity? Because physical activity is the single most important thing beyond good diet for keeping the lymphatics moving. And she works a desk job, but she gets away to the mountains every weekend and goes hiking every week. And so that's good. But we needed to consider that she probably needed to be getting a little more physical activity on a regular basis. Then we see the scurf rim, which makes us want to ask about her skin. Remember, the skin is the third kidney, and she has this predisposition towards the skin not wanting to excrete acids very well. And if that is the case, then we need to work on the skin. But again, she had no skin issues. She sweats well when she's being physically active, so I'm not concerned about that. So do you see how, as a trained iridologist, I'm seeing these indicators, but I'm not dwelling on them if they have no relevance to the current situation? Are you seeing that? I'm not talking to her about her skin health because it is fine. Her lifestyle is maintaining her skin health in spite of her inherent challenges, the inherent weaknesses, the predispositions. Then we needed to look at her stomach. Now, for those of you, oh yes, you can see this. This is good. Can you see here that right along here, there's a bit of a gray edge? This gray edge suggests that, and the fact that it looks a little bit rough coming into here, there's a bit of a, looks like someone took pinking shears and cut snippets out. This suggests that that she maybe doesn't handle her proteins very well. She maybe doesn't break them down very well. And so I needed to ask her about protein digestion. Is she burpy? Is she farty? Do injuries and wounds like cuts and scrapes take longer to heal? We also noticed that her collarette, this piece out here, this fiber that comes around here, is very, for lack of a better way of putting it, expressive. It's not smooth. It's got lots of bumps and points in it. This teaches us a little bit about her personality and a little bit about how her intestinal tract, small and large intestines, wants to function. So we needed to ask her that. And I also asked her to do a bowel transit time test using corn to see if she's actually ingesting and getting rid of the food in that healthy 18 to 24-hour time frame. Okay. So again, we've got, this is her right eye. We have here again, we've got the same oat straw yellow. We've got a little bit of tophi towards the outer edge. We've got a hint of scurfrim. We have this nutritive edge, this edge in the nutritive zone that is gray and looks a little bit rougher, a little bit chopped up, right? And so when we look at this, it's interesting because, again, you know, we saw that little patch of pigment in the previous slide that suggested that she would likely have the MTHFR defect. And partway through her pregnancy, as we were doing this appointment, I asked her if she knew if she had the MTHFR defect, and she didn't have a clue what it was, and obviously did not know that if she had it or not. During her pregnancy, she did the 23andMe and found out that she did have it, which is interesting. So here we go. Here we've got that right iris again. And I want you to notice as we look at this, I'm going to flip back one. Just let me pop back one again. Yeah, I can do this. There we go. I want you to notice I've changed the lighting here. We've got frontal lighting. And I want you to look at the wrinkles coming around her eye up around here. Now look at when we turn it to side lighting. Do you see how those wrinkles become so much more prominent? Those are called contraction furrows. And they tell us that she burns through her B vitamins, vitamin C, calcium, and magnesium at record speed. Now, when we see that, when I saw that, I needed to ask her, how do you handle stress? Well, it turns out she's in a high stress job. She's an H&R specialist. So she's working with the human relations side of a company that was going through a lot of layoffs at the time. And she was the one having to lay people off. And she's very anxious. She worries and frets about every little thing, and every little thing is actually a major crisis. Again, she did the 23andMe and discovered that, yes, she actually has the MTHFR defect. So as I'm seeing all of this, and I know she's trying to get pregnant, I'm formulating this idea based on just the things that are relevant to that. We've got her lab tests. I had her doing temperature, her basal metabolic temperature as well. So we knew that because she has all of these petal shapes, that she is prone to hormone imbalances, that she's prone to adrenal stress. right? And so we knew we needed to calm her adrenals down. We knew we needed to support her in the stress that she experiences on an ongoing basis. We knew that we also needed to support her methylated Bs to make sure she was getting those. And because we knew that she was prone to hormonal imbalances, and her temperature charts also validated that the hormones were not exactly the way we wanted them to be sitting, we were able to add the right kinds of supplements to her to build that endometrial lining, to help her handle her stress more effectively. Okay. And again, we also noted from all of these little markings coming around here, and this again is her right iris, so noticing this area, that her thyroid might want to try to cause problems, and her basal temperature confirmed that while her lab test said her thyroid was fine, her basal temps were always a little bit lower than I would expect them to be in that happy zone. And that, of course, means that that we need to support the thyroid as well. So again, in normal light, what we needed to notice, and we can't see that on these pictures because the lighting that we use with camera photography is quite bright, but in normal lighting, her pupils were somewhat enlarged, which means that she is sympathetic dominant. And as we see that, it tells us that she's also prone to stress and that we really need to support those adrenal glands, because without that adrenal support, pregnancy is also going to be a little bit more stressful for her. So after about 4 months of constantly tweaking her program, and again, we used some herbs to work on that endometrial lining. We used a good quality prenatal vitamin and that was methylated, and we added some extra methylated Bs. We added a little bit of liver support because the MTHFR defect is a liver enzyme deficiency. We added the liver support to her as well. After 4 months, we got really excited because she needed a panty liner for her period. So she actually had an endometrial lining to shed, and she had some obvious vaginal mucus. Now, ideally, the mucus should stretch. So I actually get my women to get their fingers in it and play with it and, stretch it about with their fingers. And I got her to play with it, of course, and her mucus was stretching 2.5 inches, her ovulation mucus, which is not quite enough. Ideally, we want 4. And we kept working. We worked for another 3 months, and she had her positive pregnancy test, which was great. And then she had a very anxious pregnancy because that's her style of doing things. All right. So as we talk about this, how did having her eye photos actually help me? Well, it helped me to understand that her hormonal system was inherently predisposed to being out of balance. It confirmed lab tests, it confirmed basal temperature testing, it confirmed what we saw with her mucus. And that gave me more direction, particularly to make sure we had that little bit of thyroid support in there as well. Seeing her eyes again made me suspect that she had the MTHFR defect, which we started addressing immediately. So when she got the results from her 23andMe, which she did when she was 4 months pregnant, and it said, yes, she had the MTHFR defect, and she was absolutely vibrating with panic, I was able to say, you don't need to worry. I've had your back on that since the very first appointment. We've been treating you as if, or working with you as if you have the MTHFR defect. We've got that base covered. Take a deep breath, go dance with your baby, kind of thing, right? And the eyes again helped me to understand that we needed to support her digestive system, that we needed to give her more fat, that we needed to do all these different kinds of things. But I didn't belabor every little point because, in truth, and I'm just going to pop my camera around for my Instagram people again, this exact marking and this one and this one and this one and this one, they're not relevant. Even this one, not actually really individually relevant to her fertility challenges. It's the cumulative picture for this client that is important, that we see that she is prone to stressing out, that we see that she is prone to having hormones that are unbalanced. right? And when we see that we see that she is prone to having some digestive challenges. So as we understand that, that's what we need to know about her, right? We don't need to know what every little marking means because her diet is good. She's got a great foundation to build from. We just need to be able to see constitutionally for her, what is the big picture and how does that impact what she's working on? Does that all make sense? That with constitutional iridology, we are able to get away from dissecting, from slicing and dicing, and we are able to look at the big picture. When we've got the anatomy and physiology under our belts, looking at the big picture helps us to connect the dots, helps us to see how the different organs are related to each other, how they may be impacting each other, and how what we are doing, for example, in her case with the liver, will have a positive impact not only on MTHFR, but will also have a positive impact on how she processes that increased fat load we want her to take in, and how she creates her cholesterol to be able to manufacture her hormones. Does this all make sense? Is this all fitting for you? Here is the next case that we are going to look at. And again, we're not going to talk about each and every single marking that we see. So this is a young client, a 20-something female. She has just recently graduated from university as a school teacher, and she is specializing in working with special needs children. Her heart sings when she can work with autistic children. That is her favorite thing in the whole wide world. So in doing her assessment, of course, and again, here we've got the frontal lighting. We'll look at more images of her eyes as we go. But as the first thing I always ask is, what would you like my help with? And her answer was that she suffers with depression and anxiety. She has an upset stomach with pressure every time she eats, and it's getting worse. And she has acne that's been getting worse in the last 3 months, which, no young woman wants to see that. Martha, thank you for that. She says, awesome how you tie it together. Thank you so much. Monica, glad to see this is making sense for you. And so as I look at her eyes, then I needed to ask her, are there any foods that make your symptoms worse than others? And at that point in time, she said no, except that she was dairy intolerant. So she was avoiding dairy, and she would have a cup of coffee every day. So as we run through her diet, she drinks about 1 liter of water a day. She has lots of vegetables, including raw and cooked, 1 or 2 servings of fruit a day. She likes yogurt and cream cheese, salmon, shrimp, poultry. She likes olive oil, avocado oil, and she uses grains, particularly bagels and oatmeal. All right, so as I'm looking at her eye again, and I'm thinking anxiety, depression, upset stomach, how are these all related? Digestive pressure, acne that's getting worse. I'm looking at her eye with those ideas in mind. So I'm only looking for things that are going to inform me on those levels. So this is her left eye. And now we've got side lighting. Now, as she's telling me what she likes to do, and that is work with autistic children, and I asked her, why do you like working with autistic children? And she said, well, because I don't like big groups of people. And I love that I have to really think outside the box to try to connect with them, to actually reach them. And at that point, I got super excited. I'm looking at her eyes and I'm going, oh my stars, I actually couldn't contain my excitement. It's like, oh my goodness, do you realize how perfect your vocation is for your personality type? Do you realize what a blessing you will be for those children? This touches my heart because I have a severely autistic, developmentally delayed granddaughter, and I wish she could be in this young teacher's class, because I'm sure we would see even better progress than we see now with the people she works with. And so when I look at her eyes and I see that the collarette is very, very close to the pupil's edge, this is that introvert. This is, I like small groups. I have a few close friends. I don't like big parties. When I see these loops that in the previous eye set we said suggest hormonal imbalance. Yes, they can suggest that for this client as well, but these also suggest creativity. So I was able to share with her what I could see about her personality in her eyes. And that really validated her as well, which is really nice, you know. So the iris suggests a potential for issues with blood sugars and hormone balances, endocrine balance, including the reproductive hormones. And in her case, it also suggests that she has a stronger connection to her mother and to women in her life, although she has a lovely boyfriend, of course. But and that's true, she's very close to her mom, not close to her dad at all. So when we looked at her right eye, it reaffirms that, yeah, not so much of a relationship with her dad, but it also, again, confirms the introvert, and it confirms potential challenges with her gastrointestinal system, that she may not digest food as well as we would like her to. Maria says, sweet. Love it, Maria. Thank you for that. And so as we look at this, it's reaffirming what we already know. And I've asked her questions about her diet, about her lifestyle. She's physically active. She likes to work out, do something active every day, which is a motto I try to get all of my clients to adapt. Something active every day, even if it's only 20 minutes. Doesn't have to be a spandex workout, but something active every day. And she does that. She likes to do spin classes several times a week, which is lovely. And she goes for long walks. She lives near a beautiful wooded river park, which is lovely. And so, again, when we look at those two photos, I'm going to pop back to this one, frontal lighting. Notice how we actually don't see any contraction froze in here. And notice here, when we go to side lighting, suddenly we see so many more of the contraction froze, right? So this all is speaking to the anxiety and the risk of depression. It suggests that she really functions in her sympathetic nervous system, and that she's always on edge, waiting for the next disaster, waiting for the next crisis, and that will build anxiety and depression in people. And so we know that we need to really be supporting and nourishing her on the levels that will help her to feel more calm and more in control and more resilient. So these contraction furrows underscore for us the need for her to be doing lifelong self-care, stress release kinds of things ongoing. So in her first appointment, what did we do based on what we saw? Remember, depression, anxiety, and digestion were her primary concerns. So suggested getting rid of coffee. If you suffer with depression or anxiety, coffee is one of the worst things you'll ever do. It really beats up on those adrenal glands, which you need to handle anxiety, right? We suggested that she add more protein at breakfast because she was typically doing bagels or oatmeal. And so we wanted her to have protein, and she was comfortable with adding eggs. So that's what we did with her. And suggested that because of what we saw along that inner pupillary border area, that she really needs to chew her proteins well. We also had her add a quarter of a cup of kefir to her diet for the probiotics. This is a much stronger way of adding probiotics to the diet than taking a probiotic supplement, right? And so we wanted her to do the kefir. It will help with digesting various different things. And it's a dairy, but it's partially digested by the bacteria already. So many people that don't tolerate dairy well actually can handle kefir. We had her use a stress potency B vitamin. She did not need them methylated, so that made it super easy. We added passion flower for sleep. My experience has been that when people have anxiety, they tend to not sleep well. And we needed to get her to sleep because that's when the adrenals recharge. And we added N-acetylcysteine because the N-acetylcysteine is about liver function, and we know from traditional Chinese medicine that depression comes from the liver. And from North American medicine, we know it comes from the adrenals. So we've got the adrenals being supported with B vitamins and with protein. Now we've got the liver being supported by N-acetylcysteine and protein. So that's the entire bit of iridology we did for this client in her first appointment. We didn't look at every little batch of pigment, every little opening in the fiber structure. We didn't look at the scirphrem. It wasn't, she has acne, but that's more liver than it is skin in her case. We didn't worry about all the pigment that's in here. We only concerned ourselves with markings that answered the question that the client wanted answered, which was anxiety, depression, digestion, right? And by not getting sidetracked, by understanding the Constitution, we can do an appropriate analysis in under 20 minutes, create an appropriate support program for her within about 5 minutes, and spend the rest of the time getting to know her and creating rapport, which is so important when we're talking about holistic health, correct? Would you agree that as holistic practitioners, rapport is a critical factor for us? It's something that I really, really firmly believe. And I want to know if you agree with me. And Maria says, yes, rapport is important. Absolutely. Thank you for that, Maria. Appreciate that. So about 5 weeks later, she had moved to another city, but we were doing her appointments by Zoom. And she said her gut was way better. And because of the work that we had done by taking the gluten out of her breakfast, the bagel was the real culprit there, out of her breakfast, she began to be able to correlate that the upset gut, the crampy gut that she'd been having all along was from wheat, and that gluten is a part of the issue. She still had some depression, but the anxiety was becoming much more noticeable. And she also was able to observe with the work we are doing. And Monica says yes to the idea of rapport as well. Thank you, Monica. And so does Harmony on Instagram. Thank you. And so what she had noticed was that her depression spikes when she feels like she's being attacked in some way. She'd had an uncomfortable situation at school with a parent who had disagreed with a judgment call that had been made and really viciously attacked this young teacher. Fortunately, this young teacher's admin, her principal, backed her up and said, this teacher is right. She did the right thing. That was the right judgment call to make. And that is what we need to be focused on. Unfortunately, because this client internalizes that kind of nonsense way too deeply, and I shouldn't say that, that's a judgment call. She just simply is very sensitive and she internalizes things very deeply. And it took her a couple of weeks, but in that second appointment, we were able to teach her emotional freedom technique. Now, when I have someone who has all of these markings that suggest higher risk of anxiety, teaching them emotional freedom technique is an absolute blessing, because it means whenever they're feeling anxious, they can simply go into a little 5-minute routine of doing EFT and they can back it down a lot. And for her, the reason these attacks were going so deep for her was that her father has a history. She doesn't see him much. Her parents are divorced, but her father has a history ongoing, even now, of attacking her verbally and calling her down for things and being quite vicious. And so when this parent attacked her, it brought up 20 years of that kind of abuse from her father. And knowing EFT, she is now able to begin unraveling that and getting to where she can let go of those things. So, when I look at this is exactly why I teach constitutional iridology. Judith says, when you have a rapport with your client, will be more open and you can help them better. Absolutely, Judith. That is why this is so important. That's why we don't do 15-minute appointments or 10-minute appointments, especially on a first go round, right? We book enough time to actually have time to create rapport. And doing constitutional iridology helps us build the rapport. If we can get eye photos, then we can ask questions based on the eyes, based on what the client wants help with, that are directly relevant. We're not doing that massive questionnaire that asks the same or asks people the same questions every time, regardless of whether they need them or not, right? We're asking questions that are relevant to the client. And that is a beautiful thing about learning how to integrate constitutional iridology into your practice as a holistic practitioner. So as we look at that now, there we've done 2 assessments in 36 minutes, created their programs, did the assessment, and we've actually, set ourselves up for the second appointment with these young ladies, which is wonderful because what happens at the end of that first appointment is you should have in your notes as a practitioner listed out the steps that you want to take, the first step, second, third, fourth, fifth, sixth. And each of those little steps is actually an appointment in and of itself, so that we are not doing a complete renovation appointment or a listing in one appointment. We want to give our client homework in doable bite-sized pieces so they can be highly successful and experience the positive results of that. When we do that, what happens is they are able to stick to the program. And as they stick to the program, they want to come back and tell you about their success. If they couldn't stick to the program, they're not going to come back to tell you they failed, right? They're just not. They just don't. But you've helped them create success with that one step. And as they're leaving from that first appointment and you're saying, now, when you've got this homework under your belt and you're feeling better, we're going to have you back, and you've actually booked that. That's our 4-week appointment. And you will likely be seeing these results. And when we see those results, then we are going to go on to step number 2, which helps your client in several ways. Number 1, it tells them they need to stick to their homework and they need to get it done. Number 2, it tells them that you've got a game plan. And number 3, it tells them that you've heard them clearly, that you understand what the problem is and what they want to achieve. And you've outlined for yourself a roadmap that's going to keep you on track with them. Powerful, powerful things that constitutional iridology can help us with. The next go round of, I teach iridology. Let me preface this with that. I love teaching iridology. Absolutely love it. I love teaching it to practitioners to help them be more effective, to help them streamline their work. The next go round of constitutional iridology, dynamic iridology assessment system, is starting on January 28th. On January 7th, however, we are doing an info session because typically people want to know what they're signing up for, right? And so, Maria, I'm going to answer that question in just a moment. And so as we look at this, let's take a minute and look at what this class, what we're talking about here. And then I'm going to answer Maria's question about booking appointments. In the course Dynamic Iridology Assessment System, I teach holistic practitioners, so herbalists, nutritionists, naturopaths, how to do constitutional iridology, but I don't just teach them the markings. The goal of this course is to teach you, yes, the markings, and yes, how to integrate them. You heard me tying things together as we did those 2 analyses, and that's a part of what I teach in the program. It does you no good to be able to recognize a marking if you don't know how it integrates, if you don't understand its relevance to your client's situation. And so we spend time teaching that. And the curriculum of this course is everything you need from the iridology standpoint to be able to prepare for the IPA, the International Iridology Practitioners Association certification exam. So as you can tell, even though my original training 4 decades ago was in North American iridology, my practice for the last 30 years has been constitutional, because I became so frustrated with North American iridology, with the diagnosing that they do, and with the lengthy programs and the lengthy lists of problems. And man, I'll tell you, I gave my clients those lengthy lists of markers and problems and solutions, and it was really hard to get them to come back. That is not a problem I've had for the last 3 decades. So it's really important as we do this, that in the course, that we will even talk about what kind of equipment to use to get the best results. We'll talk about this in great detail on January 7th, where I'll give you all the ins and outs of what this course involves. And if you want to join me for this info session, iridology.education/webinar is the URL to get registered for this particular webinar coming up on January 7th. The purpose of the course, it is the only live, online, fully mentored course for nutritionists, herbalists, and naturopaths who want to streamline their clinical work without sacrificing client care. If anything, what this does is it allows you to build a deeper and stronger rapport and a deeper understanding of your client's needs and the best solutions for your client. So again, if you'd like to join me for that info course to learn more, I encourage you to do that. You made the effort to be here today. This is barely the tip of the iceberg of what's included in the course, although this is the kind of content that is included in the course as well. So you'll want to join me for this webinar. Now, Maria asks, she signed up only for her first appointment and then you invited her to come back. So she booked her first appointment. We did it, and always before the end of the appointment, I always suggest that we should meet again, and we schedule that appointment. And as we're scheduling it, I let her know that in the next appointment, we will be doing ABC based on whatever her progress has been since between appointments. And so, yeah, I always get them to book their next appointment before they leave the current appointment. Always, right? We can switch the appointment around if we need to, if they need more time, something comes up, we can always reschedule. But I find that by booking appointments before they leave my office, that they like 80 to 90% hold that next appointment, right? Do you offer a package? I do not offer a package. I know many people out there will tell you offer packages. I don't, because every appointment is so custom built. Every program is so custom built. Some people only really need the initial 2 appointments and then maybe 1 every 6 months because they're already on the right track and their problems are not that huge. I do offer packages for my fertility clients. If they're struggling with fertility, I do a 6-month package with them. But my other clients, we book appointments on an as-needed basis. And I'm just much more comfortable with that. I don't like the hassle of trying to track down people. I've tried doing packages, but trying to track down people to have them use all of the parts of their package. And then when they don't use them, they're not getting the value out of it. They're going to be starting to badmouth me. They're not going to recommend the program because they didn't follow up. So what I do is no, Maria, in the first appointment, I don't give her a whole list. I give her 2 or 3 things to work on. I don't give her everything. I give her only what she needs to take her to the next step, to get to see improvement. And then in that next appointment, we're going to do another step or 2 to go on to the next appointment. I specifically am very cautious again with the packages. And that's because I want to be able to have the freedom to tailor make a program to be what my client needs. And not all clients need 4 or 6 or 8 appointments. And even my fertility people, if they get pregnant early on, then the rest of their appointments they know are going to be used for monitoring their pregnancy. So that's very doable. If they don't get pregnant, they can extend their contract for their package. But my other people, I like to book it. I like to book as we need. Harmony asks, what if you're dealing with multiple chronic health issues? We still book on an as needed basis, but we probably are going to book more frequently. I'm probably going to be offering smaller steps, fewer steps, because with chronic, there's a lot that can be done and it can be really overwhelming. So I tend to want to see them the first couple of appointments, like an hour-long appointment, 2 or 3 times over the first 4 to 6 weeks, and then drop it down to 15 or 30-minute appointments to continue working with their program. So it really depends on the individual. Totally depends on the individual. And I just think that that's important as a holistic practitioner for me to be aware and cognizant of my clients' needs and to schedule the appointments based on their needs, not based on some preset program that I've got. And that's just my take. Some people like having that preset program. It's not my cup of tea. I've never been able to work with it comfortably, except for my fertility people. So with that, my friends, thank you so much for being with me. I hope you will be joining me for iridology.education/webinar on January 7th to learn more about the Iridology program and how it can benefit you as a practitioner and how it can benefit your clients as you work doing constitutional iridology with them. I look forward to seeing you on January 7th. Take care and have a great day. Bye for now.